Myths perpetuated by healthcare providers. Running is bad for the knees and hips. It is common to hear the statement that running can be harmful and damaging to your joints, especially the hips and knees. We are sometimes told that we should avoid running if we have existing pain, arthritis, or are overweight. One study found that 48% of Canadians surveyed believed that running would aggravate existing knee osteoarthritis, and 53% believed that running will cause the need for early joint replacement. They also found that 22% of healthcare providers believe that running long distances is a risk factor for knee osteoarthritis. But is this really true? Let's investigate. It is widely established in the medical community that exercise is good for our overall health. Running is one of the best and most accessible exercises to improve the health of the heart, lungs, muscles, bones, and general health. Millions of people worldwide participate in running for regular physical activity. But what about for joint health, particularly the knee and hip joints? Most studies have shown that hip and knee arthritis is not more common in recreational runners. A study in 2017 combined and analyzed the data of 17 previous studies to compare the rates of hip and knee arthritis in recreational, competitive, and non-runners. It found that recreational runners had a lower rate of arthritis, 3.5%, compared with the competitive runners, 13.3%, and with non-runners and sedentary individuals, 10.2%. Competitive runners were professional or elite athletes, or participated in international competitions. The results showed that a long duration of elite-level running or a sedentary lifestyle are both linked with higher rates of knee and/or hip arthritis. It is not possible to determine if the running caused these results, or if they were also impacted by other factors. However, this shows that running at a recreational level does not increase the risk of hip and knee arthritis. It was also found that long-distance running was a risk factor for knee arthritis, but only at elite levels, not for recreational runners. There was also a link between runners who complete high-level volume and intensity training with hip and knee arthritis, but the study defined high volume and intensity as running more than 92 kilometers per week, and most recreational runners would not be included in this category. This reinforces the findings that recreational running has not been shown to be detrimental to the hip and knee joints. So far, we have seen that recreational running done at the levels commonly seen in the community have not been found to be harmful for the hip and knee joints, and may have some benefits in lowering the risk of arthritis. Are there other benefits on the hip and knee joints from running? Let's continue investigating. One study looked at the effect of running in individuals over 50 years old with knee arthritis. They found that running at the intensity and amount chosen by the participants was associated with improvements in knee pain compared to non-runners. It also showed that running was not associated with worsening of structural joint changes found on X-ray. In the end, they concluded that there may be a benefit from running for knee health in those with osteoarthritis. Finally, another review study found that low to moderate quality evidence points to a decreased rate of surgery for knee osteoarthritis among runners compared to non-runners. At this time, we cannot conclude that it was the running that reduced the chances of needing knee surgery, so more evidence is needed. But this is an interesting finding. The studies discussed point to a positive impact of running on the knee joints. It may be beneficial to reduce pain, improve the structure of the main weight-bearing joints of the knee, and have a potential link with reduced surgeries for knee osteoarthritis. But what about running for people who are overweight? Sometimes we may hear people saying that running may be especially harmful for your joints if you are overweight. However, it was found that at a participant's chosen running speed, overweight runners adopted strategies to reduce stress on their joints. These strategies included moving through less joint range of motion, less vertical displacement, and shorter step lengths, concluding that overweight runners who participate in moderate to vigorous running are equally as safe and effective as the general population in following an appropriate running program. In addition, starting a running program can be associated with weight loss, and continuing running supports the continuation of a healthy weight. Obesity is one of the risk factors for knee and hip arthritis, and even if you aren't running to lose weight, exercise is an essential part of arthritis management. The takeaway message is that running is not to be discouraged for people with arthritis, and research has shown several benefits from running on hip and knee joint health, even in those with arthritis. The runner needs to avoid increasing volume or intensity too quickly. So if you're just starting to run, you should avoid going too long a distance too quickly. Some other common mistakes are trying to push your pace too soon or changing your terrain or shoes, while also changing the other factors listed can contribute to injury, but these can also be variables that your physiotherapist can manipulate to keep you running when you've sustained an injury. In addition to running, it is recommended to complete a lower body strengthening program to keep your knees and hips even stronger. A physiotherapist or kinesiologist can be valuable in assisting you to safely progress in your running program and to provide an appropriate strengthening program.